Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
For adults, taking care of our bodies include regular checkups with our doctor for recommended screening tests and probably a regular trip to the dentist.
But what about the eye doctor? Of the estimated 61 million U.S. adults at high risk for vision loss, only half visited an eye doctor in the past 12 months.
Eye exams at every age and stage of life can help keep your vision strong and detect any problems early on, especially in that early treatment of common eye disease can help prevent permanent vision loss.
Here to discuss eye health is Mayo Clinic ophthalmologist Dr. Sophie Bakri. Welcome back to the program, Dr. Bakri. It's good to see you.
Thank you, Tracy.
How often should adults have an eye exam? We probably worry more about our teeth than we do our eyes. Is that fair to say?
That's fair to say. So I would recommend an eye exam perhaps starting at the age of 50, and that could be every year, every 2 years, every 5 years, depending on what the eye provider finds. Now, if you have a family history of eye disease, such as glaucoma or any kind of disease that runs in the family, then perhaps you should start much sooner.
How come?
Well, glaucoma, for example, is a silent disease that can affect people, even as young as 40 or even younger. And so it's not detected unless you have a formal eye exam and formal testing. And it runs in families. And that's just one example of many diseases that could be detected early and treated.
So, Dr. Bakri, when we have our eye tests, do we go to our primary care physician and use those charts and read the letters? Is that what you're talking about?
Now, what I'm talking about is a formal eye test by an eye care provider, and there are different types of eye care providers. There are optometrists and ophthalmologists.
What's the difference?
So, ophthalmologists are physicians and surgeons who go to medical school, do a residency in ophthalmology, and then perhaps 1 or 2 years of subspecialty ophthalmology training in a particular condition. Optometrists go to optometry school and sometimes do an optometry residency as well, and they're more general eye care providers.
And so in terms of eye care providers, when I think of ophthalmologist or optometrist, maybe I'm wrong, but I'm thinking that they're going to see somebody to get glasses. Is that correct, or is there a difference?
So that's one of the first things that is checked. If your vision isn't perfect, in other words, it's not 20/20, the first thing to do is see if you have a refractive error. So in other words, seeing if glasses would help get your vision in better focus. So that's really the first step. And then if they fail to give you a perfect focus, then that indicates that you may have some eye disease, and so you need to take it further on.
I'm sorry, go ahead.
No, and so what are the common eye diseases you mentioned?
So in adults, the common eye diseases are cataracts, glaucoma, macular degeneration, diabetic retinopathy.
Let's talk about a few of those. We'll start with diabetic retinopathy because, as we hear in the news, and certainly on our program here, diabetes just more and more becoming a problem in our country. How does diabetes affect our eyesight?
So diabetes affects the eyesight very slowly in most cases in a way that won't be detected unless patients visit an eye care provider. And so when patients are diagnosed with diabetes, particularly type 2 diabetes, because that's a slow onset disease or may not be diagnosed in an acute fashion, patients may have had eye disease brewing for a long time. So it's important upon diagnosis of type 2 diabetes to visit an eye care provider immediately. And what they look for is specifically hemorrhages in the retina and also swelling or edema in the macula as well. And at a later stage, the eye can start to grow new blood vessels, bleed out, get vitreous hemorrhage, and at the most severe stages, tractional detachment.
That sounds like something that someone would be able to feel, but you're saying that if someone has that diabetic retinopathy, they can't feel it?
Correct. So when you have small hemorrhages scattered within the retina, you won't know it. Even if you have mild edema or swelling in the retina, you may not know it. Now, you may think, well, my glass is dirty, or am I just having a bad day, or am I tired? And typically, a lot of people have these sorts of generalized symptoms before actually realizing it's time to visit an eye doctor.
And so, Dr. Bakri, many people will talk about floaters. What's actually a floater? Does that feel as if something's actually in the eye itself, like dirt?
So interesting, floaters in French are known as mouches volantes, which means
that sounds much
flies.
better. Flies.
Which means flies. And that's exactly what patients see. You know, you could be looking at a white screen and think that there's a fly in the way, or that there's a hair in the eye. And those typically happen with age. So about 60% of patients over the age of 60 have these symptoms, and over the age of 80, it's about 80%. And you typically see them when looking at a clear day or a white background.
What's happening to create that floater or that fly?
When we're born, the vitreous jelly is very solid, and as we age, it liquefies, and the collagen fibers change, and so that's really what we're seeing. And then as time goes on, the vitreous attachments to the retina become looser. And so when patients complain of a sudden floater, it's typically what we call a vitreous detachment. So the vitreous is just pulled off, and then they see floaters, and if they're really unlucky, a retinal tear.
But that's unusual for it to be a retinal tear.
Well, it's about 10 to 15% of patients who have symptoms.
And if a retina tears, what does the patient experience?
So the patient won't know it. They'll just notice, if they're symptomatic, that they have floaters. Now, there are many tears that are asymptomatic, but if they're symptomatic, they'll have floaters. They go to the eye doctor. The eye doctor finds a tear in the retina and then recommends laser treatment.
So if you have a floater in your eye, it doesn't mean you should run through the red lights to get to the eye doctor, but if they don't go away, then maybe you should? Is that right?
Well, I wouldn't say race through the red lights, but if you have a sudden onset floater, then I would, perhaps drive slowly, but I would definitely get there.
Or maybe
Get it
get
checked
somebody
out.
else to drive.
Yes, that's even better.
Let's talk about macular degeneration, because people are living longer. That's giving their eyes more years. So that must be an increasing problem.
It's a very, very common problem. And as you mentioned, the biggest risk factor is age, but also there are other risk factors. Some are non-modifiable, such as being Caucasian or having lighter colored eyes, but others are modifiable, such as UV exposure and particularly smoking.
So some of my friends who are a little bit older than me, they say, as you get older, you need glasses because you can't see as well. Is that macular degeneration?
So that's presbyopia.
He's talking about me. We were just talking about my arms aren't long enough anymore. Yeah. Presbyopia can start when? At any time?
Well, so actually it typically starts at the age of 40, believe it or not.
Mm-hmm.
And in 40, most
You've got a
people
few
are
years
in
to go
denial.
yet, Tracy.
That's nice of you, Dr. Kakar. Yes, keep going.
So I wouldn't classify presbyopia as a disease, whereas macular degeneration is a disease. At least presbyopia is something that is completely correctable with the proper eyewear.
It's just called middle age, Dr. Kakar. You're just going to have to deal with it when it happens,
In about
okay?
10 years, yes.
Oh, yeah, very good. Anything else that you want people to know about their eye health as they get older?
So I just think it's important that when patients get symptoms to visit the eye doctor and not just assume that the glasses are dirty or that they are feeling a little bit tired.
We've been talking about adult eye health with Mayo Clinic ophthalmologist Dr. Sophie Bakri. Thanks for joining us, Dr. Bakri.
Thank you.